studio with us this morning from McDonough District Hospital, we have CEO Mr. Bill Murdock. Good morning.
Thank you. Good morning.
Also with us is one of your vice presidents, Mr. Patrick Osterman. Good morning, Patrick.
Hey, good morning, Vanessa.
So congratulations, Bill. It's official.
Well, yes, it's been a long haul here, I guess. I've been interim CEO for the last 5 months, but I've been at the hospital for 5 years, primarily in the CFO role, financial role.
And that CFO role, that is so key. And what a balancing act. We were reading, a story this morning about the struggle of rural hospitals, a lot of it due to the reimbursement from state and federal programs.
Yes, that's very much true. And then we also struggle with volumes, just given the population declining and all that. And then we're also pressured with labor cost as well, trying to find the right people to fill a lot of important positions. So balancing all that has been a real struggle for the rural hospitals.
Okay, how do you best do it?
Oh, that's a great question. We do bring in locum labor to fill those voids till we can get the important positions recruited and filled. We do a lot of cross training between departments. A lot of people just step up and roll up their sleeves and get the job done.
That's what it takes, doesn't it?
That is what it takes.
Okay, well, hopefully we're going to see the federal and state dollars get those more incoming to you guys on a regular basis. But it's also the amount of dollars. Sometimes it's 10 cents on the dollar. Sometimes it's 50 cents. Either way, you're losing out.
We are. We're highly governmental payers in our market. We're 50% Medicare and 20% Medicaid, so that's 70% government payers for us. And all those services are money losers for us. We try to make it up on the commercial side, but that's challenging, trying to make up that balance with that piece of it. It's hard for us to have leverage with the insurance payers and try to increase our payments, but we do what we can and make it happen. And
it's interesting because the 30% commercial side, trying to fight those insurance companies to get stuff approved,
right?
It can also be a challenge.
Right. It's big with denials and just no payment at all. It seems like it's a constant battle. Pat and I were down in Springfield a couple of weeks ago talking with our legislators how we can work with insurance companies so we work better together, get our payments faster, not have to fight those battles on denials and just pre-authorizations and everything else that's needed to be done to get payment.
Pat, how did you feel the talk with the legislators went?
I think they were very receptive to what we had to hear, what we had to say, what they heard. Great example, last year was passed, first time in 28 years they were going to do a 10% Medicaid improvement in the payment schedule from the General Revenue Fund. And again, it's just a landmark. First time in 28 years, a state doing that. But now we were back there a couple weeks ago, Vanessa, in early May, and talked to them to make sure that effective January 1, it was supposed to go into effect. But we got to make sure with this new budget that's in the process of getting passed through the legislation right now, to make sure that's fully funded. Because that 10%, it may not seem a lot, but it does add up quite a bit. And what Bill was talking about, too, with battling the insurance companies, it's the staff and the labor that's involved with that, because you're taking somebody who could be focusing on another duty when they're spending 2-3 hours on the phone with the insurance companies fighting to try and get this reimbursed, or if you got to pull a doc away from seeing patients and they're on the phone with the insurance company saying this is why you need to do the pre-authorization. And typically, they're supposed to be talking to a peer on the other line, and sometimes it could just be an auditor, and their job is to try and say no as much as possible. So it can get frustrating. I guess that's kind of the nature of healthcare this day and age. But, you just keep fighting the good fight, and you just hope that the legislators that are representing us in Springfield, they hear what we have to say, and they're fighting there for us. And I think they do a really good job backing us, especially when the rural hospitals.
Yes. And the rural health clinic that you have here is open here in Monmouth. Give us the history, Bill, on McDonough District Hospital.
The history on McDonough District Hospital, it was established in 1958. It's a county-owned hospital, but we're not supported by any tax dollars. We're standalone. We act autonomously, that operations. We have about 500 employees. So we're a major employer in the area with good paying jobs, benefits. We see about 14,000 ER visits a year through the emergency room. We have over, I can't remember the number now, like 49,000 clinic visits in a year. So we have a lot of volume going through there with our local community.
Yeah, you sure do. 14,000 ER visits over a 365-day period.
Right.
We're so fortunate to have rural hospitals. It's so important.
Yeah, you don't realize how blessed you are to have that health care so close to home. If you had to travel somewhere else to get it, that can make a big difference in someone's life.
Yeah, absolutely. Okay, and major employer, absolutely. 500 people in the town of Macomb, and of course here in our local area, other people drive there as well as come to McDonough District, the MDH clinic right here. Tell us about the clinic.
Oh, sure. So we have a convenience clinic. It's a walk-in clinic where you can come in and get your care. And then the anchor of that building, I guess, is our rehab unit. We have seen that growth here in Monmouth over the past year and a half that we've been in that market, and we're also actually looking to expand here in Monmouth that book of business for the rehab section as well.
Is that Dr. Lori Fox, Pat?
Well, Lori Fox is one of our physical therapy assistants. Yeah, she does a great job over there, and we do have a great staff. Phyllis McLeod is the director of sports med and rehab. Very in tune with everything what's going on, and I know here around the area, a lot of schools are just wrapping up their school year, but we're already starting to look ahead to next school year. School and sport physicals, we'll be having those in the Monmouth Clinic, so make sure you stay tuned for that. We'll have some news on that here in the next few weeks, but never too early to start looking ahead to next year for us at the MDH Monmouth Clinic.
Absolutely. And Bill Murdock, we're talking with him. He's recently been named the CEO. He was the interim, so now we're official.
Right.
And but you've been there 5 years, so you've got your pulse on what's going on. So recruitment-wise, what do we do as our rural hospitals? How do we best recruit?
I think the best tool is taking our current staff and building and reaching out to their colleagues in the area and recruit them that way. Yeah, we can do the advertising, try to reach out nationally, but the better fit is trying to find local talent to fill our needs at the hospital.
One of the interesting things that's happened recently is Monmouth College and OSF announced their partnership with the 3+1 nursing program. Is that something you can look at, or potential partnerships with WIU?
I think that's something that when it comes to Western, you look at Spoon River College, we have their students come and do clinical hours at our hospital. So it's a good opportunity for us to kind of showcase our organization with the students. Sometimes the students, they're coming here for college, they're going to go back home. We understand that, but it's a good opportunity for them to get hands-on experience, and we certainly want to try and keep the local kids as much as possible. We do have a new effort that we're going to be looking at starting in the fall, where we can start with the CNA program, Certified Nurse Assistant program, start that training as early as high school. So when you're done with high school, you're already licensed as a CNA, and that's really kind of jumpstart those who want to get into the nursing career. So good opportunities. I think it's one of the things, and under Bill's direction, kind of leading us to kind of think outside the box a little bit. How can we do from a recruiting standpoint, from a revenue generation standpoint, to make us a very viable organization? As Bill said, we opened in 1958. 60 plus years, we need to be here around for our residents, for the people of West Central Illinois for the next 60 years and beyond.
Yes, I have heard of this. It's happening in Pekin, Illinois. I have a friend. She's her daughter's a freshman. It's the first thing that they're helping her do is decide, do you want dual credit? Do you want XYZ?
Right.
Well, she wants to be in nursing. So, yeah, they were telling me she was going to be a licensed CNA by the time she graduates high school. I thought, well, goodness.
Yeah,
that's amazing.
That's where a lot of it starts, is in the school system. Just get them comfortable with coming into the organization, trying to figure out their niche, what's important to them, and what field they want to concentrate on.
Yes. Well, Bill, what do you want to concentrate on for your next 5 years?
Oh, well, I think you brought it up about the challenges of rural healthcare. One initiative that we've started, and Pat's been heavily involved with it too, is collaborating with our competitors to strengthen programs and certain service lines. We've reached out to Graham Hospital, Carthage Hospital, OSF, Blessing Hospital, and seeing what we can do to work together and build strength in programs, and maybe bring some new initiatives to the region as well.
That makes sense, because if we are challenged overall with net revenue coming in, labor costs, and recruiting labor, wouldn't it be best if we strengthen each? Who's good at what? Who's got the people that can cover this? Who's got the people that can cover that? And strengthen the health of our local area.
Right. It just doesn't make sense to be redundant with services offered by all different organizations. If we can just concentrate on the one area and make it the best it can be, that's the way we need to go.
Yeah, definitely. Okay, what else do you want people to know about MDH?
Oh, goodness. We got our community pharmacy opening up here. It'll be completed here in July, I guess I should say, and then it'll go through inspections and certification and should be officially open late fall of this year. So we're excited about that. It's a beautiful building. Come on down, take a look at it at your convenience. What else we got going on?
Well, on that note, if you don't mind,
Sure.
Bill, there's another challenge that we have as pharmacists. And so this works out. A lot of hospitals across the nation are thinking about having a pharmacy on site because it's just easier.
Well, yeah, it's convenient for the patient, right?
Yeah.
You come right
That's
out
what
of
I mean.
Right.
If you need something called in, it's going right there on the same campus.
Right. You can come right out of the clinic, get your script, go to the pharmacy, pick it up, drive, go home, and so it's very convenient. And we've already started hiring for those positions in that community pharmacy, and hopefully we'll be up and running here in the fall.
Good for you guys. Yeah. Okay, Pat, anything else you want people to know?
Well, just to piggyback on that, 7 days a week, I think that's going to be key to try and hit those hours of convenience for patients, because, Vanessa, that's what it's all about. It's providing a positive patient experience, taking care of our patients. As far as looking ahead to the summer, obviously Memorial Day weekend, big weekend. Want to thank everybody who has served and think of those who have fallen serving our country. But as we start summer, just some reminders. You're out there at the ball diamonds. If you're out there in the fields, make sure you stay hydrated. Make sure you got your water with you, some drinks. If you're sun safety, make sure you got your sunscreen. And if you're out camping, watch out for the ticks, and the mosquitoes. Make sure you got your bug spray. Just be cognizant of that. Nobody wants to spend time in the summertime at the emergency room. It's always nice to know, as you said, it's always good to have your local hospital there handy, but everyone just be safe this summer.
Okay, good advice. Gentlemen, thank you so much for coming in this morning.
Well, thank you for having us.
And congratulations again, Bill.
Oh, thank you. I'm looking forward to the next 5 years and seeing what that does for MDH.
Absolutely. You'll do well.
Oh, thank you.
Bill Murdock with us. Also, Patrick Osterman with McDonough District Hospital and the MDH Convenience Care